We're looking at the scene outside a hospital in New York City. That's a makeshift morgue under that tent. They haven't done that since 9/11. New York City is the epicenter of the coronavirus outbreak, not just in the United States, but really globally. More than 30,000 confirmed cases right now, nearly 300 deaths in the city. There were 13 in one hospital in one day. It's just incredible. So at this rate in New York City, cases are doubling every 3 days. Now, we watch New York City particularly closely. There are 21,000 Canadians who live in that city. And also we heard from the coronavirus task force about how anyone who had been to New York City should self-isolate for 14 days. That would include Canadians who had traveled to New York City prior to the travel ban. And we heard from Ontario's chief public health officer yesterday that the number of cases in Ontario, a large number of the travel-related cases are in fact linked to New York City. So there's really good reason for us to pay attention to what is happening in that city. And I want to introduce you this morning to someone we're going to be getting to know over the next few days from New York City. Will Denslow is with us, and it's a pleasure to meet you on our program, Will, and to welcome you to our network at CBC News Network. Those shots are just extraordinary. The morgue outside the hospital because of this incredible surge in cases. What is really the battle that New York City is waging now?
Well, incredibly is absolutely right. There are now over 1,000 COVID-19 related deaths in the United States. Well over a quarter of those are in the state of New York. We've heard from the governor, Andrew Cuomo, who says that the problem here in this state is 10 times worse than any other state in the country currently. That is the huge issue that they are facing. Now, we've already heard reports that New York City's morgues in hospitals are reaching capacity. That is why the state, along with others, including Hawaii and North Carolina, are calling for FEMA assistance to set up temporary morgues like the one we've seen at Bellevue Hospital, on the one on the east side of Manhattan. Now, we've heard steps are being taken in New York to further increase social distancing. One of those that's being piloted is that several major roads in New York City are set to be closed. That to try and allow people more room to roam about because of the real issues when it comes to overcrowding in New York City's parks at the moment. Now, while there are some grim updates coming from officials here in the city, there is some degree of optimism. Andrew Cuomo, the state's governor, saying that there is some evidence that social distancing measures underway are having an effect.
Tell me a little bit more, if you would, Will. We're going to take a quick look at Times Square. As you mentioned, the city in lockdown, and Times Square is just so illustrative of what's happening in New York City. There is nobody there. People are heeding the words from New York's governor, Andrew Cuomo, and he has been strongly making his case every day. What kind of appeals are we hearing from him that are most striking right now?
The main appeal from the state's governor is for people to stay home. There's also a huge appeal for medical resources. Currently, he is calling for around 140,000 beds that are needed. Around a third of those are currently available. 30,000 respirators he's called for. The city has or has sourced around half of those required. There's also a huge call for medical volunteers. Around 40,000 hospital workers have signed up already. That is a huge appeal for the state's governor. There's also financial appeals to be considered. Of course, we've had the Senate $2 trillion bill. Andrew Cuomo, however, says that's just a drop in the bucket for New York.
Will, thank you very much. Really appreciate that coverage, and we'll be connecting with you as we watch what is the center for the pandemic in the United States and the real global focal point as well. Will Denslow.